You are watching the Pharma Manufacturing Fundamental Video Series, Pharma Lab Monitoring 101. This video is created in collaboration with Ziltrix North America. More information on Ziltrix North America will be provided later on.
Safeguarding valuable scientific equipment, assets, and materials from deviations or failures 24 hours a day, 7 days a week is challenging. In the pharma industry, the need to continuously prove compliance with strict regulatory and quality standards that require constant monitoring and measurement of equipment and facility conditions is also cumbersome and time-consuming. When the average cost of a drug development program registers between 2.5 and 3 billion, it is imperative that every facet of the lab is monitored to secure high-cost investments. Recently, there has been a shift towards biopharmaceuticals in the industry. Biologic drugs currently make up about 40% of the over 16,000 drugs in the global pharma pipeline. These biologic hopefuls include drugs in new therapeutic areas, such as cell and gene therapy, that are igniting the industry on fire with their potential to treat the previously untreatable. Monitoring cell growth and protein production is vitally important to the quality of biologic drugs. As these costly new classes of therapeutics race towards commercialization, the industry will need to better equip development and QC labs to handle their complexity. This video will provide a quick overview of what needs to be monitored, as well as the common challenges faced in lab monitoring. Lab equipment, including cold storage equipment, cryogenic storage systems, bioreactors, incubators, gas concentrations, lab mixers and shakers, water baths, equipment start-stop cycles, and equipment alarm outputs. Equipment must be constantly monitored and protected for optimal operational efficiency. Equipment errors and failures can damage valuable samples and distort research results, potentially resulting in a failed drug development program or experiments that cannot be reproduced. Lab environment, including relative humidity temperature, particle counting, VOCs, differential pressure, light intensity, airflow, ammonia levels, or other vivarium conditions. It isn't just laboratory assets and equipment that must adhere to GXP quality standards, but also the ambient conditions of the entire facility, from temperature and humidity to particle counts and VOCs. All of these areas must be continuously monitored and measured. Environmental monitoring requires managing complex schedules for collection and analysis for thousands, even tens of thousands, of samples per month. General facility, including HVAC, backup generators, and uninterruptible power supplies. Without monitoring HVAC functionality and quality, organizations may be subject to undesirable conditions and issues. Proper HVAC monitoring can lead to valuable insights on air quality and laboratory conditions and leads to consistent research results. Additionally, monitoring a facility's backup generator to be certain that the generator has switched on and is providing power to the facility is a key component to minimizing downtime as the operations team works to restore vital building systems, preserve sensitive environments, and protect valuable research samples. Creating innovative drugs requires innovative labs, but safeguarding a state-of-the-art, innovation-based laboratory is no easy task and requires foresight, experience, and attention to detail. The following are some common monitoring challenges faced as pharma companies push to modernize. Collecting and leveraging real-time data. Next-generation monitoring requires more than antiquated data loggers that create a false sense of security and only tell you after a problem has already occurred. Labs need to collect real-time data regarding specific parameters that affect the science directly. From there, this real-time data needs to be leveraged to actively monitor and anticipate equipment malfunctions in order to proactively schedule calibrations or repairs. Complex system configuration and administration. Today's pharma companies have lab monitoring systems with hundreds of users, each with individual roles, specifically assigned equipment, and alarms. Poor configuration and management leads to false alarms, alarm fatigue, and ultimately undue risk. Disparate systems and equipment. Multiple types of equipment in every lab from multiple manufacturers means there is no standard output from devices. In order for data to be useful, it needs to be collected and presented in a standardized way. Unreliable wireless networks. Certain Wi-Fi networks can be unreliable depending on infrastructure. They can deprioritize devices on the network, kicking devices off network and causing false alarms. Backup systems also require batteries that need to be changed. With the wrong system, spotty connections can result in data loss. Complicated lab layouts. Pharma labs can often spread across multiple rooms, buildings, sites, or even different countries. This complicates the standardizing of monitoring processes. Without tight adherence to SOPs across all sites, pharma organizations are subject to errors, losses, and failures. Strain on internal resources. Implementing and maintaining lab monitoring systems requires a lot of internal resources. In addition, implementing, learning, and managing a new monitoring technology often creates ongoing obstacles to address, resulting in systems being abandoned by end users. Integration. Data is often being collected with multiple systems, which complicates the process of making data meaningful for analysis and improving operations. Lab devices and equipment need to integrate with other systems to allow automated recording of important data and increase visibility over the entire pharmaceutical process. Research reproducibility. Strict control of equipment functionality and room conditions must be kept to eliminate variability and increase the quality of research. An in-depth study on research reproducibility and the economic costs associated with low reproducibility rates estimated that $28 billion per year is spent on research that is not reproducible in the U.S. alone. Compliance. Systems need to support FDA GxP compliance regarding quality, data security and integrity, and reliability. GxP quality guidelines and regulations emphasize the importance of establishing proper SOPs and the necessity to maintain daily documentation and reports for all ambient parameters and equipment. Given pharma's strict regulatory environment, failing to capture accurate and reliable data can have serious adverse effects when labs are required to prove quality and compliance.
This video was created in collaboration with Ziltrix North America, a powerful, highly interconnectable laboratory environmental monitoring system that watches all facility ambient parameters and the well-functioning of your equipment, clean rooms, and facilities in real time. Visit ZiltrixUSA.com to learn more.